Yeah, sleep is the foundation of everything. When we talk about the pillars of health, it is sleep, it is physical activity, and is nutrition. So I would say sleep is actually the pillar because if you don't sleep well, then you're not able to really optimize the benefits when it comes to nutrition and your metabolism. And physical activity, if you're not sleeping well, you're not able to recover well and things like that. So many areas are affected by sleep. So even our brain health for our kids, right? Their brains are rapidly developing.
Welcome back to Mother's Guide Through Autism podcast. I am Bridget Shipman. I'm your host. And today I have Dr. Funke Afolabi-Brown, who is a triple board certified sleep physician and the founder of Restful Sleep MD. She's also the best-selling author of Beyond Tired, a sleep physician's guide to solving your child's sleep problems for good. We are going to talk about why sleep is so important for your child's development, and Dr. Funke is going to give you some practical strategies to solve your child's sleep issues and yours, so stick around. Welcome, Dr. Funke.
Thank you. Thanks for having me.
My honor for sure. As a parent coach and as a mom, I know how important all this is. I'm really looking forward to our conversation. Let's start with who you are and what you do.
Yeah, so thanks again for having me. So I'm a sleep physician, but maybe I would start by saying I'm a mom as well. So mom of two and a sleep physician, and I help busy parents and their children sleep better. That's my mission. That's really the foundation of my practice, my coaching, my speaking. It's all about how do we optimize sleep for wellness so that we can thrive as a community and the family is the unit and reach our fullest potential. So I do this in different ways. I have my clinical practice, like I mentioned, it's the Restful Sleep Place. I have my speaking, coaching, and consulting business. That's Restful Sleep MD. And then I have my book. I wrote a book on sleep as well for parents. So that's really the way that I get that information out there.
Yes, and thank you for doing what you do because we all need help with it. So, would you tell us how you came to be a triple board certified sleep medicine physician?
Yeah, so I initially had, after medical school, I did my residency. That's the training as a pediatrician. And then I went ahead and did another training, which is called a fellowship as a pediatric pulmonologist. And the focus there was really taking care of kids that have breathing issues and asthma, all those things. And then finally, I got a sleep medicine fellowship where, the focus is really understanding sleep science, understanding how sleep works and how people can address their medical sleep issues and things like that. So after doing all of that, I just really fell in love with sleep and I decided to just pitch my tent right there.
Well, it's an important tent to pitch, as I keep reiterating that. But why does sleep matter so much, especially for our kids?
Yeah, sleep is the foundation of everything. When we talk about the pillars of health, it is sleep, it is physical activity, and is nutrition. So I would say sleep is actually the pillar because if you don't sleep well, then you're not able to really optimize the benefits when it comes to nutrition and your metabolism. And physical activity, if you're not sleeping well, you're not able to recover well and things like that. So many areas are affected by sleep. So even our brain health for our kids, right? Their brains are rapidly developing. And one of the things we know is that sleep is a very active process when it comes to brain development and growth in children and in adults as well. So that's one. Their emotional stability. So during sleep, emotion regulation is occurring. So when they wake up and they're dysregulated and cranky, sometimes that might be why, because they didn't sleep well. And then, we talk about things like the physical health, growth hormone release. Some of these other hormones are released during sleep. And so when things go awry, sometimes it's related to poor sleep. And then, older children and adults, we start to talk more about their heart health. So there's a higher risk of hypertension or strokes, abnormal heart rhythms when there's poor sleep. So those are just some fundamental things that are impacted by sleep.
Yes, you brought up the brain. How does sleep work in a kid's brain?
Yeah. So the way sleep is broken down in that sense is broken into cycles and stages. So there are two main stages of sleep. There is what we call the rapid eye movement sleep, which is more of the dream sleep, non-rapid eye movement sleep. So when you're going through sleep, and everybody goes through this, you go through initially light sleep and then deep sleep and then the REM sleep. You wake up briefly, very, very briefly, we call it an arousal, and you just cycle through all through the night. When there are issues, either there's an underlying sleep disorder, those cycles are fragmented, they're broken, and so that impacts the entire quality of a night's sleep for a child. And so, in terms of those stages, that light sleep is, and you might know this, notice this, this is the stage when you're just a little bit drowsy, it's easy to wake you up, versus deep sleep where it is really hard, right? If you think about older kids, you're trying to drag them out of bed, the alarm is going off, they're still sleeping. So you're in really deep sleep. And then the REM sleep is more of that dream sleep, which is when you tend to have more active dreams and things like that. And people talk about, oh, maybe deep sleep is better or REM sleep is better. I usually will say every stage is better. There's a reason why you should have all those stages of sleep. So, things like REM sleep is very important when it comes to emotion regulation, learning new skills. Deep sleep really related to that, growth hormone secretion, like I talked about, restoration, muscle recovery, all of those things. And then light sleep, some memory processes occur during that stage. So there's so much richness in sleep that we can't afford not to sleep well.
Yes, well, for myself, I can really tell the difference when I don't get a good night's sleep and how I function in all areas. But there are sleep disorders. What are some of the common sleep disorders in children?
Yeah, so with sleep disorders, I usually tell families to categorize it into almost three different categories. So the first most common are behavioral sleep issues, right? So these are the troubles that most parents complain about. I can't get my kid out of my bed. My child wants me in bed with them. We have to rock our baby to sleep. We have to give them a bottle. We have to, all those things are behavioral in nature. They're fighting bedtime. Bedtime routine is a nightmare. All those things are really behavioral sleep issues. Or your child who wants to be on their devices all night or wants to drink caffeine. All those things are behavioral sleep issues. The second category are medical sleep issues. So things like sleep apnea, where you have snoring and pauses in breathing during sleep. And that really fragments sleep. That's actually pretty dangerous. And kids have sleep apnea as well. Things like restless leg syndrome, where you have a kid who's constantly complaining either of leg discomfort or they're moving around a lot at bedtime. So that's one other example. And then you have some other ones that are not as common, but it's definitely something we want to look out for. Things like narcolepsy is one of those things, circadian rhythm disorders. So there's quite a wide array. And then you have sleep issues that are related to an underlying medical problem. So if you have a child who has autism or who has ADHD, or who has anxiety or who has depression, they tend to have sleep issues that are somewhat related to those underlying problems as well.
Yeah, so you bring that up. I'm very curious about factors that do contribute to sleep disturbances in children with autism.
Yeah. So there are a few things. Sometimes it may be the sensory impact, right? Sometimes you just can't seem to get them to settle. Sometimes it's nutritional. So again, I go back to those three buckets, but I think I told you only two. So there's the behavioral, there's the medical, and then there's what we call 24-hour factors. So when you have a child who constantly has an active brain, I always say, like, your child's autism is not like sitting by the bedside table saying, okay, I'll see you tomorrow and we'll continue with autism. You'll pick up from where you stop, right? They have that baseline depending on how functional they are, depending on how impaired they are. That kind of rides with them and also impacts their sleep. So this is why it's really important to sort of make sure that when you're building your team for your child's autism care team, that you are including people that are knowledgeable in as many of those different areas as possible, right? Because people will tell you, oh yeah, it's because of their autism. Okay, so now what do we do? They're not sleeping,
Yeah.
right? So I think it's really important we address that. So the other piece that I see often that can contribute to sleep problems is things like their nutrition. So many times these kids may be picky eaters. They're not necessarily eating chopped liver and a whole bowl of spinach and green leafy vegetables, right? So many times they're deficient in different elements, right? And so those nutritional deficiencies can actually affect sleep. So iron deficiency, magnesium deficiency, vitamin D, all those things can contribute to poor quality sleep or restless sleep. So when I'm looking at this, children come in to see me, we're looking at what are medical issues that we can see. Sleep apnea, like I talked about, is also something we see in children with autism, restless leg syndrome. So we're doing a whole full evaluation. I can't say it's one thing. Sometimes it's a combination of so many other things, right? We're doing an assessment of their environment because sometimes their bedroom environment is what's contributing to poor sleep. If they have these very uncomfortable beddings, they'll be, and sometimes if they're not verbal, able to express what's going on, that might be the issue. If there's light exposure, inappropriate timing of light, that can also be a sleep disruptor. So there's a whole wide array of things. Some of them have that sensory piece I see a lot. So how do we get them better balanced from a sensory standpoint with the overload so that they can maintain sleep? So that becomes something that we're working towards as a goal too.
Yeah, so I loved how you said that. Yes, our kids are having trouble with sleep. Maybe it is because of autism or ADHD or whatever neurodivergent factors in, but what are some practical strategies that we as parents can do to help our kids?
Yeah, so a few things. I usually will say, let's start with the basics. I mean, most times people will say, oh, yeah, we've done everything. And then I say, okay, tell me about your bedtime routine. Oh, yeah, it's hit or miss, right? So we want to try to make sure the basics are covered. It may sound, you may have heard it over and over and over again, but just kind of troubleshoot with that because access to especially a pediatric sleep physician is very rare, right? So make sure you've covered those fundamentals because you don't want to get there and, of course, I talk about routines all day, every day, but you want to make sure you've done those things. And then when you're at the point where, well, we've done everything, then you can come and it makes more sense, more value for you. So when I talk about the basics, I have an acronym. It's called CREATE, CREATE. So C stands for consistency. So you really want to make sure you have, and your child, you have a consistent sleep time and wake up time. I think this is so important in children with autism because sometimes the typical cues that a neurotypical kid, I don't know what neurotypical is anymore though, right? But those typical cues that children without autism might have, your child with autism might not have it. So this is where when you have a routine that is very predictable, it's almost like you reinforce that in their brains. This is what we do. We have some massage time. And once we do that, or we have a book we start to read, or we take our bath, or we clean up, that is when it's time. That sends signals to our brain that it's time to start to wind down, right? So having a routine is so important. And then the C part is the consistency of that routine, the consistency of their sleep time and their wake up time. This is so important as well. So they know when sleep is coming and they know when they're supposed to get out of bed. So then the R is the routine. And then E is the environment. I cannot talk about that enough. That environment needs to be cool, it needs to be dark, and it needs to be free of noise as much as possible. Those are things that can impact sleep significantly. And then A in CREATE stands for assign the bed for sleep and sleep in bed. So it's really important that you pay attention to this because sometimes we use the bed for so many other activities that are not sleep promoting, right? You're playing video games, you're watching TV, you're doing all kinds of other things in bed. So you really want your child to see the bed and know that the bed is for sleep. And that's what we do when we get into bed. And then T is technology. So, that's our whole podcast episode.
Yes, it
Because
is.
devices, the phones, the iPads, the video games, all of those things are very stimulating. That's for me, it's more of the stimulating effect. I mean, people talk about the blue light. Yes, the blue light may suppress melatonin to some degree, but the content, a child whose brain is already super active, and then we now expose them to a show where there's fighting and there's different images, that tends to be very alerting for them. And then the final E is eliminate. So here you're talking about what are things that are in their habits? Is it caffeine? Is it heavy meals? Those kind of things can impact your child's sleep. And so you want to get rid of them.
Yeah, I love the acronym. It's easy to remember that way. So
Mm,
create, that really registered. And so those are things that we can do that seem very practical and easy because when we get our kids to sleep, that means mom gets to sleep. So let's
yes.
talk about sleep for moms too. Would you give us tips on improving their sleep, our sleep as a mom?
Yeah, yeah. The beautiful thing I love about that acronym is that it works the same. It works for you, the whole family. So I think something else I add to moms, especially moms who are taking care of kids that are developing differently, right? Whether developing differently from a neurocognitive standpoint, whether it's their physical health, whatever it is, it's a lot. It's a lot to juggle just to be called mom. It's like that title comes with just its own level of some stress, right? So, how do you make sure you don't forget yourself? I think the first thing I will say is that you're so important. Your well being is so critical to your child's well being. So, don't neglect that because I think that should take precedence. Because when you're not well, your child's not going to be well, right? When you're running on empty, there's not much you have left to give a child, who, especially if it's a child who has high needs, right? So focus on that. So the way I do that, I'm a lover of acronyms, as you'll come to find out, is through another acronym called REST, REST. And R stands for respect boundaries. As parents, we lose those boundaries so quickly, right? And it could be boundaries with ourselves. Sometimes you just don't take care of yourself. You don't say no. You don't say no to multiple obligations and requests. So learn to respect boundaries. Sometimes it's boundaries with our kids where they've pushed and tested our limits and we're just like giving in. Sometimes you need to set the healthy boundaries for them and for you. The E is expectations. So you have to be realistic. What do you have in front of you? Don't compare yourself. Realize that you're not superwoman. You're human. And so really set those expectations because many times as parents, especially in this day and age with social media, we go online and you see these Pinterest worthy pictures and you are just like, I can't even get my kids to wear a hat in the winter. Like, oh, what am I doing? Right. So set those expectations. Your own path, your own journey is unique to you and your family. And I think that's really important. And then the third thing is S is, sleep. So make sleep a priority, which will take us to creating those healthy sleep habits. And then T, I say, is this it feels like a lot, but you have to make sure you take stock and live in a state of gratitude. It's your child had a great session with occupational therapy. Count that as a win. Don't forget those things and look at where you are, look at where the choices, the decisions, the path you're on, and being able to reflect and say, okay, these are areas I need to set boundaries. These are areas that's not working. These are areas I need to delegate and ask for help or whatever it is. And I think if you follow that, as well as being consistent with your sleep time and wake up time, establishing healthy bedtime routines, making sure you optimize your bedroom environment, making sure that you're assigning the bed for sleep, making sure you're addressing the technology because it's not just for our kids. Sometimes we finish and then we plop into bed and we're scrolling, doom scrolling on social media for hours and hours. So really set limits with that for yourself as well. And then eliminate those things. Are you drinking caffeine? Are you drinking alcohol? Are you taking very heavy meals close to bedtime? That's something that you may want to address as well.
Yes, I also love acronyms because I will absolutely remember what you just taught us. So rest, I love that. I think moms will hear that, but really applying what you're saying is going to be a key element. And if it feels too big, just choose one of the letters for today.
Yeah.
Because
Oh,
I coach moms, and the big thing is the overwhelm. And
yes.
so just remember those acronyms, right? And then just apply them one letter at a time and whatever serves at the moment.
Mhm.
I love the gratitude too, by the way. I
Mhm.
love that. Please tell us about your book, Beyond Tired.
Yes. So my book was published last year. Its title is Beyond Tired, A Sleep Physician's Guide to Solving Your Child's Sleep Problems for Good. And I wrote that from a place of service, really, to families that were coming. Like I mentioned, it takes probably anywhere from 6 to 8 months to get to see sleep physicians, the traditional sleep physician. And when I see patients, I tell them, I mean, not in my practice, because which is why I built a different model, but I see people come in and the things that I'm just like, oh my goodness, if somebody had told you X, Y, and Z, you won't, things may not have needed to progress to this level. And that was really what it was. What are things I want families to know where they can work on very practically from a place of grace to move them forward? And that's really what it is. So we talk about ways to improve your child's sleep through, those routines I talked about, the CREATE acronym. I delve into so much detail. And really from when your child is sent home with you from the hospital all the way to when they're ready to graduate college, right? Like the whole spectrum. So we're really, really addressing it because most of the books out there tend to focus on, kids within those first few years of life. Well, those sleep issues persist after that. So this is more of a very comprehensive guide. But what I think is helpful too, especially for moms who don't have time to sit and read from cover to cover, is you could just jump right in and say, okay, I have a toddler who's having a lot of behavioral sleep issues, and jump right in there, grab the tools you need, and then keep moving. Or you have a teenager who's now really struggling with school and balancing everything. Well, go right in there and you guys can read it together. I've had so many teenagers read it and say it's been so helpful too. And then I have a chapter in there also for children with neurodiverse conditions because I think their sleep issues is pretty unique as well. So yeah, so that's really what the book's about. Is on Amazon. And so you can grab a copy either on Kindle or hard copy for yourself and for someone that you have in your world.
What a great way to write the book. I love that. Basically, so this book meets you where you're at, right? So wherever you're at and whatever stage of your journey, you can pick this book up, you can open it and find what you need for that moment, put it back down, and sounds like a book that you want to keep handy, you know, depending on what's going on with your family sleep habits. I love that. And so with that, you've given us CREATE, that acronym, and then also your book and just rest, all the beautiful things you're teaching us. What is your advice for parents raising a child on the spectrum?
Oh my gosh. Community. Find your people. You can't go it alone. There is someone who has gone through what you have gone through. You need to find that community and you need to find community that aligns with you because it is a hard journey and you will have moments, you will have ups and you'll have downs. And so that community is not just a place where you want to share your woes, but the place where you want to share your triumphs as well. I think that is important. And also in that community, find a place where you can receive help. So sometimes, especially as women, we're just like, well, this is my lot in life. I'm just going to bear this burden and just suffer. No, there's no need to do that. There are people who want to help, they just don't know how to. So be vulnerable enough to ask for help. When people say, what can I do to help? Don't just consider that as, oh, they're just being polite. You'd be like, okay, sure, I could give you a couple of things you could help me out with. So please do that. Ask for help and make sure that you're doing life in community.
I think that is great advice. And that's absolutely truth. It is difficult. I would even say impossible to do it alone. I love that message. You don't have to. You do not have to do it alone. Is there anything else you would like to mention before we go?
No, I mean, I think we covered quite a lot of content. I would say you're the person for the job. Like there was a reason why you were given that beautiful child who has incredible superpowers and your nurture, your love, you caring for yourself, you helping them prioritize and optimize their sleep is a gift that would last them a lifetime. So just keep doing it.
Love it. Love it. I know you mentioned early on about where people can find you, but can you tell us one more time where can our listeners find you?
Yeah. So I'm on my website's a good place to start. It's www.therestfulsleepplace.com. You can also find me on social media, on Facebook, on Instagram at Restful Sleep MD. And then, yeah, those are two main places. And then my book, you'll find it on Amazon. So if you put my name up, Funke Afolabi-Brown or Beyond Tired, my book will pop up. So those are places that you can find me. My website has tons of resources. I have blogs there that are where I'm pretty active. I have newsletters you can sign up for where I give nuggets every week. I also have a YouTube channel. It's at Dr. Funke Brown. You can find all of that through my website.
Thank you. Yes. And we'll also list this as we release our conversation, this podcast episode. So, on behalf of all of us, all moms, all parents, anyone who tuned in, thank you for being on Mother's Guide Through Autism.
Thank you so much for having me. I enjoyed this conversation.
If you enjoyed this episode of A Mother's Guide Through Autism, please like and subscribe to our YouTube channel and come back for more episodes like this where you can really learn a lot and also use practical tools to apply to your life. So thankful for our guest today, and I will see you in the next episode.